So, very good morning, everyone. Welcome to Women's Day special live talk on our We Talk Do You show on puberty to menopause. I am Santosh Kumar Das, and I'm truly honored to be your host for the important set conversation today. So, before we enter into the discussion with the expert today, let me share you a brief about Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited, a One Health company with a vision of shaping global healthcare by spearheading One Health initiative. IL was established by National Dairy Development Board in the year 1982 as its units and later registered as a company in 1999 with the name of Indian Immunologicals Limited. HBI was established in the year 1998 when the Government of India requested IL to produce a modern tissue culture anti-rabies vaccine to phase out unsafe nerve tissue vaccine. The first manufacturing facility of HBI was established at Ooty. The facility is one of its kind in India to have rolled out first varicella culture rabies vaccine in 2000. Subsequently, HBI launched other vaccines and currently we are a major player in human vaccines. HBI is a leader in anti-rabies vaccine segment and is present in around 60 countries. With three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, which is a Genome Valley, HB has forayed into the market of clinically proven wellness products and infertility range of hormones. With the vision of shaping global healthcare by spearheading One Health initiative, to innovate, produce, and market high quality healthcare products and services to improve and extend life. HPI value in believing in providing affordable products with high quality through continuous technical innovations and improvements to meet customer needs. HBI, a division of Indian Immunologicals Limited, has also entered into various corporate social responsibility, such as adoption of government school. IL has adopted two government school in Karkapatla facility in Hyderabad, which is in Telangana. IL is providing basic infrastructure and basic facility, including helping in midday meal scheme, as a result of this intervention. The strength of the children in the school have been doubled within a few years, and the school have won several awards at the district level. With the gift milk program in coordination of National Dairy Development Board, IL provides over gift milk pro- gift milk to 2,500 school-going children in Telangana and Tamil Nadu. IL has also donated oxygen generation plant to TIMS Gachipoli, Hyderabad. Human Biological Institute, a division of Indian Immunologicals Limited, a One Health company. Please follow us in the social media channel like Facebook, Instagram, Twitter, and YouTube. So today we are talking about infertility, a common issue that affects millions of women but is often misunderstood and rarely discussed. Infertility is more common than we think, and it's not just a personal struggle, it's a medical condition that deserves awareness, understanding, and right support. That's why today, with an expert to guide us through this crucial discussion, Dr. Sonali Gupta, an esteemed infertility practitioner who has helped several individuals and couples for their journey in parenthood. Dr. Sonali Gupta is a leading specialist in infertility treatment with years of experience in reproductive health. She is a gold medalist from BHU with a fellowship in gynecological hysteroscopy from UK, and she holds a diploma in IVF and reproductive medicine from Germany. She has been on the forefront of cutting edge treatments, patient education, and bringing the myths around infertility. Her passion lies in empowering women to take care of their reproductive health and make informed choices. Today, our conversation is centered around empowering women's health, understanding and addressing infertility. We'll be discussing the common causes of infertility, the role of lifestyle, age, and medical conditions, and various advances in infertility treatments. And of course, there'll be some question and answers during the live session, so feel free to drop them in the comment box. Dr. Sonali, thank you for joining us today. And it is our pleasure to host you. And to start with the discussion, Doctor, we'd like to understand that what is infertility? Does it happens to both male and female? And what is this IVF is all about? And what is the role of hormones in infertility?
Thank you for the warm welcome, and thank you Human Biologicals also for creating an awareness
Welcome,
program
ma'am.
on especially on Women's Day and exclusively on infertility and IVF. Yes. So first of all, I would like to answer what is infertility. Any married couple or any couple who are planning to conceive, and those who are staying regularly for 1 year and still they are not able to conceive, they comes under subfertility evaluation. See, we can never say the couple is infertile. This is subfertility, means there may be some minor variations, some biological variations, because of them they are not able to conceive. Once they get evaluation, once the problem is corrected, they definitely they will conceive.
Thank you, doctor, for busting this myth. It's a very common problem which happens with so many couples. They don't even understand like what is the complications with initial complications. So the as you said, that initial guidance is very important to address this infertility, which is a big going to be big menace for this country. Like Doctor, what are the most common causes of infertility in women and how we can address this?
See, if we go to the pathological causes, if we the most common cause is the PCOD and endometriosis. I think we all are familiar now. People know more about PCOS and endometriosis than
PCOD.
anyone else. But there are some social factors also which are leading to subfertility. In the modern era, the husband, wife, both are working. They are not staying together. है ना? Sometimes the job of husband is in a different place, wife is working in a different place. So they are not able to meet at correct timing. That is also one very leading reason of infertility. Also, males, the working environment, sometimes the temperature is high, sometimes the job posture is continuous sitting position is there. That cause leads to low sperm counts. And male infertility is also prevalent. So if we can divide it into two causes, one is the social causes, second is the pathological causes. Pathological causes, the most important cause is PCOS, endometriosis, and definitely tuberculosis. So, early diagnosis is the key step. If you are facing any difficulty in conceive, the guideline says if you are not able to conceive for 1 year, if you are staying continuously during your fertile periods, you must seek an expert advice. If the age of the woman is more than 35 years and she is not able to conceive in 6 months, you should take an expert advice. If the periods of women is irregular, you should take a preconceptional counseling, then only you plan for pregnancy. If the husband has a previous semen analysis, any abnormality, maybe in count, maybe in motility, or maybe in morphology, or any sexual dysfunction also, that is also increasing because of the smoking habits. So in that cases also, you must seek an expert advice.
So thank you, doctor, for very clearly helping us understand what are the subfertility causes. And you already clearly said that yes, it is not the women who has been only
Hello.
affected with infertility, it is the men. Hello, is it audible, ma'am? Hello, ma'am, you're audible. Hello, madam, you're audible. Hello. We lost a doctor. She'll be back again and we'll join her. Yeah. So welcome, doctor, once again. Hope it is audible.
There, huh? Yes, there was some
Yeah, we
connection.
lost you. There is snack, technical snack. So thank you for giving a clarity of subfertility. And you have already said that yes, how it is not the women which has been already infected with. Sorry, I mean a woman who is responsible for the infertility as a role, but men has a bigger chances also being infertile or adding to this infertility trauma. So as you said, ma'am, what percentage of men you feel that in today's world are again adding to this cause?
Was. I think the in current scenario, 30% cases the female causes are more. In 30% cases, male causes are more. But and in 40% cases, the combined factors are there. There is minor
Combined.
in male, minor in female, which is adding the problem and creating a burden on subfertility. In my practice, at least in Bihar, I feel so.
Ma'am, you see any stress related factor which has a role in infertility?
Yes, always. Not a small role. It has a big role. If you are not able to sleep properly, the work is
Yeah.
over anxiety, that causes an imbalance in the hormone level, also in male and also in female. The spermatogenesis means formation of sperm in male, and oogenesis means ovulation in female. It is completely dependent and regulated by our brain hormones. And these stress factors, they are they create some local factors which increases the anxiety. The hormonal variation is more, and it affects the ovulation and spermatogenesis. So first of all, you have to be calm, realize it is completely treatable. Only you need a proper guidance and expert advice and some time. Definitely it is treatable.
So, ma'am, what kind of dietary or healthy practices you would recommend or advise to the audiences, both for the male and female, to have a healthy, fertile life?
Ji. See, diet habit should be manipulated according to the disease and the problems. What is the pathology behind the subfertility? The diet is usually suggested. What basic I can share here is take a balanced diet. Balanced diet means it should be rich in protein, carbohydrate, fat should be less if you are overweight or if you have a normal weight. If you are underweight, first correct your weight, then you go plan for pregnancy. For males also, making high protein diet, biotin rich diet, multi vitamins rich diet, a balanced diet, no smoking, no alcohol. That is good for our fertility. It improves the sperm count and also improves the quality of the sperm also. Whatever diet you are taking, it should be based on your local situation. See, there are a group of people, sometimes they come to me and they ask, Madam, where I can take this fruit or not, especially the curiosity lies nowadays with kiwi and avocado. See, if it is
Kiwi and
avocado, people ask sometimes
avocado.
avocado. They sometimes they search on
Yeah,
internet ki this is a good food. Definitely this is a
yeah,
good food. But suppose you are staying in an area where kiwi is not easily available. You have to not easily
not easily
available. You
available.
have to process. Matlab, the processing time, the transport time is more. Then do not take. Wait for kiwi only. You can take any fruit which is locally available. It should use less amount
Mm.
of processed food which is locally available, which is in your nearby area. It is always good for your health. Whatever diet you are taking, take sufficient amount of water, stay hydrated. Hydration is a very good step for our metabolism and our activities. Okay. Now the third thing is take
Yes.
sufficient amount of sleep. 6 to 8 hours. 8 hours of sleep minimum is required for a good fertility, for our proper hormone function. So take sleep at a proper time. Usually I recommend my patient go to sleep by 10. Go to your bed by 10. You will automatically fall asleep by 10:30 or 11. Use less mobiles at the time of sleeping. Maintain a healthy lifestyle, balance your things. Definitely, you will get good results in a very few days.
Thank you, doctor, for being so elaborative and so clearly giving the common I mean, it is very difficult. Normally, people go and search internet and they find out various fruits, avocado and kiwi, which is not the Indian fruit though. But yes, as you said, local fruit had got lot of nutrients, and definitely it will help us in having a healthy fertility life uh, to continue. And doctor, can you have a understanding on like how age can be a factor, because the generation which has which are coming up now, they feel that yes, they have a career goal and they want to delay having a child, or the delay the decision. So what is the best age for this, and up to what are the choices available for this, the new couples to keep I mean to plan a baby later on in their lives?
Yeah. See, in the modern era where the infertility treatment is easily available and it is curable, है ना? If you are having, you can definitely, you should have a planned pregnancy. It is always better to avoid the complications obstetrical as well as the subfertility issues. So, the best timing I feel is 27 to 30 years. The peak fertility of a female is in that age, but it is dependent upon your various factors, whether the periods are regular or irregular, whether you have any previous medical disorder in form of any ovarian cyst, you have any prior history of tuberculosis, any chronic infective disease in form of male or female. Males, if you have it, what are your habits, social habits, smoking, drinking? Is there any habit of all these things? Any drug abuse? And what is your job profile also? What is in which job you are staying? That also affects our fertility. So these factors should be taken care if you are planning for pregnancy or if you are delaying for pregnancy. I think before taking your decision, you take an expert opinion. If you have any problem, suppose if you have PCOD, if you have endometriosis and you are planning to delay your fertility, you can freeze your eggs. Oocyte freezing is a very good option. It is very easily available and it has a very good retrieval rate. Also for the male factors, if you are, suppose if you are in a such a job where you cannot plan your pregnancy, or if you are in some stage of your career when you cannot plan your pregnancy, you can preserve your sperm. That will be preserved for long time in the same, and the effect of any environment, any pollution will not be there. So you take an expert opinion and definitely they will guide you best. The option of fertility preservation is easily available nowadays and it is a very good option. I strongly recommend it. If you are delaying your fertility, before taking your decision, you take an expert advice.
So the takeaway is again having a freezing technology which is now readily available. So it's a good choice for the people who plan would like to plan a later stage in their life. But yes, as you said, if you have definitely some issues related to underlying conditions, you need to definitely visit your gynecologist or infertility specialist and plan your child accordingly. So, doctor, what are the latest apart from this freezing technology? Is there any other fertility treatments? What are the various kind of treatments available in infertility or fertility management?
Yes, so most of the infertility, subfertility, I say, it is treatable with medicine. So small, maintaining a healthy lifestyle, many of the people they conceive. Proper education is also important. You should know your correct ovulation time so that if the husband and wife they are staying at a different places or the job is like that, we can time it. है ना? Okay, we can also schedule for ovulation. If we are planning for, suppose the husband is planning to come in next month, then we can plan ovulation if the female comes to us in 1 month before. That is also planned. Then intrauterine insemination. That is also a very good option. It is very easily available, cheap, cost effective also. And it means we are washing the sperms and the healthy sperms are inseminated through a plastic cannula into the uterine cavity at the time of ovulation. Then definitely IVF is a good option if you are having any subfertility issues in form of low sperm count, poor ovarian reserve, irregular periods, or any endometrial factor. Then also we can easily use in vitro fertilization IVF ICSI if you are having genetic issues or in form of recurrent pregnancy losses. which is commonly means patient is having patient is getting pregnancy, but they are not able to continue. There is a role of genetic factor in that. That can also be treated with IVF using the pre-implantation genetic testing.
Okay. Man, under what condition you feel IUI is recommended?
IUI usually is done if there is any cervical factor, if the coitus timing is not proper, and in unexplained infertility also cases when the ovulation is or if the ovulation is not at the correct time, the IUI is recommended.
Okay. Uh, now,
One
ma'am,
more.
you are
There
in,
are many.
you are based at, yeah,
There are
please.
many
Yeah, you're
factors
saying
who are
something.
not able to do proper coitus because of male sexual dysfunction or female sexual dysfunction in form of vaginismus or erectile dysfunction or ejaculatory dysfunction. This is also increasing. Majority of them is a psychological problem, but still the problems are increasing. In those cases also, IUI is a easy and safe technique.
Okay. Uh, Great. I think of the IUI, IVF, ICSI has been covered. So now, doctor, just wanted to understand that you are based at out of Patna, and nowadays there are several common myths and misconception about infertility. So, could you please explain certain few myths and misconception during your
Ah,
practices? You have been already seeing so
yes,
many people, I guess.
definitely. The first misconception which the majority of the people they ask from me, कि madam, the baby which is in IVF is not our baby. The majority of the people they have, and this is the reason they do not turn for IVF. See, I said proper age is
Oh.
important. You have to take the treatment at right age. In infertility, in IVF, you can have your own biological baby if you are getting treatment under an expert at a right center, at a right place, and in a right time also. If a female is coming to me after menopause, suppose say the age is 45 years, definitely the oocyte, the ovarian reserve has gone. Now the option is only oocyte donation. Anyway, we take the decision after some workup and infertility evaluation, but once the age has crossed, we have limited option. So in that cases, we have to use the option of oocyte donation or sperm donation, but it is not always. If a young couple is coming to us for proper fertility treatment, you can have your own biological baby. I have many people with very poor ovarian reserve with one oocyte, two oocytes retrieved, but they are now having their own babies. So correct timing is important. You have to take an expert advice. Always choose the correct center. That is also important.
Yeah. Any other, ma'am, misconception you like to discuss apart from that? Because that's a common misconception. People feel that yes, IVF baby is not mine, so that
Sometimes
becomes.
they feel that IVF babies are not normal babies. They are something different. That also
Huh. Yeah, that's the concept. That is also
common.
there. Yeah, they're not normal. They're born before the delivery time. They're not
Mature
matured
and
enough. So they struggle in life. This kind of
misconception.
misconception is also there.
Yeah,
So how do you?
that also the because one thing I think in IVF the calculation of dating is not done with your last menstrual period. In normal pregnancy, we do the dating of babies with our periods rate. But in IVF, the date calculation is different. It is done with the transfer date, and some days are added which depends on which stage we have done the transfer, whether it was a third day embryo transfer, whether it was a fifth day. So correct date or the maturation will be decided by your IVF consultant or your obstetrician. So that is also a myth. Because of this reason, some people, once you say for delivery, now 37 weeks, which we ask as a maturity timing, you ask to get admitted at 37 to 38 weeks. They calculate their own date. They do not come. And that ends in some obstetrical complications. So that is also should be taken care. And one more important thing, they feel that IVF babies are not normal. No, they are just like a normal baby. Only the process of fertilization, which was not able in inside the uterus or in the fallopian tubes, that process is done outside. Rest all process is similar. It happens inside the woman's womb, so they are just like a normal baby, but a proper antenatal care is needed in view of any to rule out any high risk obstetrical factors. Hello.
Yeah, I think we lost a bit in between, but yeah. So, Doctor, yes, as you shared, we have got certain question in between. One question is like, do you see hypogonadism cases in female infertility, and how hypogonadism cases you define, and how often you see these cases?
Yeah, this is also a prevalent problem, hypogonadotrophic hypogonadism, which is now giving low sperm counts and also anovulation. So you get a proper diagnosis, meet the expert, you take the opinion, make a correct diagnosis, whether it is hypogonadotrophic hypogonadism or it is the premature ovarian failure, because the clinical presentation is little bit similar. So we have to make a correct diagnosis. If it is hypogonadotrophic hypogonadism, it is correctable with gonadotropin injections, which we are giving regularly. I think out of 10 IVF cases, I think one or two patients they are having hypogonadotrophic hypogonadism nowadays. I do
One out
not know
of
whether the problem
10.
is increasing or the diagnosis is made easily. That is also one also. The diagnosis is also made easily.
So 1 out of 10, ma'am, you were suggesting?
I feel for IVF cases, 10
Yeah.
cases who are selected for IVF, I think 1 of the 10% they are having this problem and
Okay. And
getting.
how do we address this?
Yeah, there are gonadotropin injections which we are giving after correct making a correct diagnosis. But see, making a correct diagnosis is important and proper compliance is also important. Once you have started the gonadotropin injection, you take it at regular intervals, complete the treatment, then only reassess your semen analysis or ovulation.
One more interesting question which has come up, ma'am, uh, related to weight factor. So, what is being commonly asked is now people who have at a certain age above 35 and having a great, I mean, have issues with obesity. Do you feel that yes, that is the biggest factor for infertility is going to be a concern for that, or how they can manage the weight during this time?
See, weight is one of the leading reason of anovulation and PCOS and infertility nowadays, but it is not the sole reason. So do not compare yourself with others. The problem comes with comparison. No, do not compare. If a female who is having 70 kg, she can also be pregnant. A woman who is having 30 kg weight, she can also be pregnant. The only thing is there are different guidelines. If your weight is normal, if your weight is heavy, or if your weight is low, you have to take expert advice, manage the things before you planning for pregnancy. Definitely, if you are planning a pregnancy, the weight should be in optimum range. It is always recommended to reduce your weight before planning for pregnancy. Okay, so that the chances of fertility is less, and also the obstetrical complication is less, chances of infertility is more, chances of anovulation is more in obese patient or in underweight patients. But always the problem will come in obese and underweight, that is also not correct. Sometimes if the weight is normal, these patients they can also have problems. So maintain a healthy weight. If you are planning to conceive, do some physical activities which are not heavy. Swimming, skipping, this is also a very good exercise. Skipping is also a very good exercise for PCOS patients if you are overweight. Or the floor cleaning, which a few years back the females
People used
used
to
to
do.
do at their home. Now it has been replaced actually with instruments and all these things. So
True.
that also reduces our waist circumference, which is very good for ovulation in simple language. So I always suggest these things for my patients. For male
I think
also,
I
chances
think
of
there was
yeah,
very clear guidelines of having the waist circumference because that is important. I think factor for ovulation and all.
for
So
ovulation.
and in today's world, floor cleaning definitely people are not doing. Either it is done by the housemaid or it is done through the robots. So that will be a great practice. I think that's an exercise which can be done easily at home.
These are the basic exercises which can be incorporated without any uh, loss or without any extra burden, financial burden.
Yeah. Doctor, anything related to coffee? Because they say that if male infertility and coffee, is there
See,
any?
yes, sir. This is also a myth, actually, I feel. There
Yeah.
are many people who particularly ask about coffee. See, anything if which you are taking in a limited amount is not bad. Even the alcohol. Even if
Hmm.
you are taking in a limited amount, it is not bad. It is good for health. If you are taking anything in excess, whatever
Yeah.
it is, it can be vegetables, it can be proteins, it can be anything. Excess of anything is bad, especially if you are in your fertility age group. So I think 1 or 2 cup of coffee, if you are taking, that is not bad. It is actually good. It improves circulation, and some studies they say that caffeine, the caffeine is actually beneficial for our fertility. Uh, some hormones are released which are balancing our fertility. That so 1 or 2 cup is okay, but excess of anything is bad. Excess caffeine is not good because it is a proven cause of miscarriage.
Now, two quick questions, doctor. What are the key factors to consider when choosing a fertility clinic and a specialist?
See, you take first of all, I would always suggest you take an expert advice. Do not directly jump into infertility IVF. You
Yeah.
take a fertility expert advice, get a proper evaluation, find out the cause of infertility, give some time, and definitely you will get result. Then if you are reaching any IVF center, you see the standard lab should be there. What is the success rate of the center? What is the experience of the clinician? It is a multidisciplinary approach. It is a joint working. Yes, what is the uh, expert clinician should be there, and also an expert embryologist should be there to get a proper result.
Yes. Thanks for sharing this, doctor. One more, I think, a question. How partners would support in with each other for this during this infertility? What is your advice on this?
This is a very good question. Definitely, partner support is one of the key step for the success. See, in 40% cases, the male and female, the both are responsible. There are minor factors. Some is in the male factor, some is in the female factor. So we should not blame each other. Whatever is the cause, it is always suitable. Give uh, have emotions with each other. Take just give some time for your daily conversation also. Whatever treatment the woman is undergoing, she needs an emotional support, and whatever treatment the male is taking, he needs a good compliance also. Because what I face, we recommend medicines for males, they do not take properly. So the compliance is good, and that can only be supported with your partner. Female, they need emotional support because in majority of the area the females they are not working. They feel I am taking these medications now, that is creating an extra burden on my family. So in that case the partner can support. This is a practical thing which I want to share, which I am
Yeah,
facing actually.
true.
Rest is theoretical, it is always available in Google. So the need the support. See, balancing the finance and emotion is the key step for your success, and it is treatable in modern practice. It is easily available. The only thing is you should take an expert advice, have patience, give some time for your planning. Definitely you will be successful.
Great. Lastly, ma'am, three takeaways for today's discussion. I think we have a very fantastic and elaborate discussion on infertility today. You have definitely busted many myths, and more important, you have shared certain practical things which we face, and people can really take up in our day-to-day practice. So, just three messages you'd like to give to the viewers, please.
Yes, the first is the stay hydrated, drink plenty of water, give some time for physical activities. For males also, for females also, they can go for outing, they can go for brisk walking and take a healthy diet. If after this you are not able to conceive, you take an expert advice. I feel you will conceive. It is certainly treatable. The only thing you need is should be in correct time.
So, as we now wrap up this session, uh, this session, I want to extend a heartfelt thank you to all our viewers who have joined today. Your engagement, questions, and support truly made us this discussion meaningful. A special thanks to Dr. Sonali Gupta from Nilkant IVF from Patna for sharing her expertise and shedding light on such an important topic. And your guidance has been truly invaluable in empowering women with knowledge about infertility. So let's continue breaking the stigma, supporting each other, prioritizing women's health. Uh, if you found this session helpful, don't forget to like, share, and follow Puberty to Menopause for such a informative discussion. And stay tuned; we'll be coming with such more sessions with such more experts later on. Until next time, stay informed, stay empowered, and take care. Thank you, ma'am.